Good morning, Robin.
So let's start with vaccines. The Moderna and also Pfizer getting shipped now. Talk about when we're going to see both of these or any of them.
We're going to see both of them. The Moderna one, they expect to file their emergency use authorization very soon. That will give them approval to distribute the vaccine. It's easier to ship than the Pfizer vaccine, and they estimate that it could be out on the market by the 21st of December. Pfizer has received permission from the FAA, the aviation authorities, to transfer its vaccine because it has to go in so much dry ice, which is considered a hazardous substance. Fortunately, the storage facility for the Pfizer is in Pleasant Prairie, Wisconsin, which is just across the Illinois border, just south of Kenosha. So the main storage is in the near Chicago. We're going to be lucky.
So if and when both these vaccines become available, do you expect that people will have a choice and they can choose between which one they want?
I think at the beginning, Dan, that what's going to happen is you get the first one you can get your hands on. I don't think we can be selective at the beginning. We'll be able to be selective later. When you get 5 of these things out there on the market, you can pick which one you want. But the first one out the door is going to be taken up by the highest risk people.
Let's talk about these numbers in Illinois. After Thanksgiving, it seemed like there was a dip yesterday in the numbers of infections, but you always say we got to wait a couple weeks to see the real effect of the travel, right?
Right, we do. And as far as the weekend and testing goes, just forget these numbers. They're going to be all over the place just because people aren't going to go get tested on Thanksgiving Day. They're taking the day off the next day. A lot of the testing places are closed. It's going to start evening out today. That's when you're going to see the testing kind of really even out. And we will see what happens from this travel. It's a human experiment that we just witnessed.
And speaking of testing, you have some free testing in Northwestern?
Yes, we do. We're testing a new strip test that it's basically like a pregnancy test. You take a nasal swab, put it in a little liquid, and then put the strip in there. You get a result in 15 minutes. This is not an approved test, but to compare it to something good, we compare it against the standard PCR test that's done at Quest Laboratories, one of the big commercial labs. It's the test run by the Roche Cobas, the real standard PCR test. So if somebody wants a free test, we are taking people now, or probably for the next couple of weeks.
And they just email to get it, or they just show up?
No. You have to email. Please email, because we don't want to have a waiting room full of people. So we're scheduling people either by telephone or by email. So
Gotcha.
There isn't an email and a telephone number. You can call either one or email, and you can get an appointment.
All right, let's get to some questions here, starting with this. After receiving the COVID-19 vaccine, how long does it take to be effective? Will it be 2 weeks like the flu shot?
Well, it'll start to be effective in 2 weeks, but it won't be fully effective, optimally effective, until several weeks, probably 3 weeks after your second dose. So you get some protection, but you're not really going to be safe until like 3 weeks after the second dose. So it's going to take about 2 months to get total protection, but you get some effect.
Okay, next question. Drug companies are determining, is it efficacy by waiting for study participants to show symptoms? How can drug companies know the true efficacy of a vaccine without testing for asymptomatic cases? I used that word twice in that question.
Yeah,
I'm very proud of myself. Go ahead.
Good. Congratulations. But this is a great question, and it would be the perfect way to study the vaccine. But you just can't do that many tests on asymptomatic people. Look, they tested 44,000 people, and they're talking about 190 cases. They're not going to be testing all those people all the time. It's just physically impossible. So they've got to wait for the symptomatic patients to prove the case. But this person is right. In an ideal situation, if you had a real quick rapid test that wasn't too invasive, you would be testing everybody all the time.
All right, next questions. If I've recovered from coronavirus and have antibodies, is it safe for me to travel and visit family for Christmas without the risk of spreading the virus?
Well, it depends on a couple things. If you really had coronavirus, so in other words, you had a clinical condition that was compatible with it, and you had a test that was really good, like a PCR test or even one of the antigen tests if your symptoms really fit the picture of COVID. And then you have to have, then prove that you have the antibodies. It would be probably very safe. It's like taking the vaccine.
All right. Well, thanks, Dr. Murphy. If you have a question for the doctor, you can post it on our Morning News Facebook page. We'll talk to him again tomorrow. Have a good day.